All right. Hi, everyone. Happy Monday.
Hi, everyone.
My name is Risa. I am here with Dr. Sabrina Fabi. I see a lot of you joining right now, so I'll just give you a minute or two to start joining. But today we are going to be talking about the lower face and neck contouring with Dr. Sabrina Fabi. We're really excited. She has phenomenal information and before and after photos and some videos to show you today. So I hope it's going to be extremely informative. So let me just give you guys a little longer to get in here.
Thanks everyone for joining. I'm really looking forward to being able to answer your questions today. And I hope everyone's family is doing well and is staying healthy.
Yes, for sure. Okay. So while we are waiting for more people to join, I am going to launch a little poll so we could tell us a little bit about yourself. Let's see. All right, so does some of you see a poll that came up on your screen? If you do, you can please start answering. Also, on the bottom of everyone's screen, there should be a couple little icons, one that says Q&A and one that says chat. And the Q&A are great places to start popping in any questions that you'd like to queue up for Dr. Fabi. And the chat can also be used if you're having any trouble or if you need any help or have any questions just in general. I'll be moderating it to try and get any of your concerns answered. I don't see anything in there yet, and I see a lot of you answering, so I think the poll is working. All right, I'll just give it about 15 more seconds for this poll. At the end, you guys have to click submit. All right, can everyone press submit? I'm going to end this now. All right. So let me just share these results so we can all see. So I know not everyone is into the webinar yet, but so far it seems a lot of you are existing patients, so we're very happy you were able to join. Most of you have not attended an in-person event before, so welcome to your first CL Derm event. Email and Instagram is how you heard about this. Most of you in San Diego or California, but we do have some international people here. And most of you before have had Botox, about half of you fillers or lasers or esthetician treatments, but very few of you body sculpting treatments. So this should be very exciting.
Wonderful. So I think we should go ahead and start.
Okay, great. So again, if you guys are interested in asking any questions for Dr. Fabi, use that Q&A section. You can also use the chat feature to ask me any questions. And now I'm gonna give a little intro about Dr. Fabi and then let her take it away. So Dr. Fabi is a world famous board certified dermatologist that we are honored to have at Cosmetic Laser Dermatology. She is renowned for all types of treatments, from injectables to lasers to body sculpting to veins, and she's also involved heavily in research and teaching a lot of her other colleagues, like dermatologists around the world, her advanced techniques. But today she's going to specifically be talking about a really hot topic that a lot of us are interested about, especially these days that we're doing all these Zoom and FaceTime meetings. We all hate, well, at least I do, and I think many of us do, hate our necks and jaw lines and how it looks. So I'm really happy to let Dr. Fabi educate us and try and give you guys all some good information to help you get through these difficult times, and hopefully it will be a way to help. And here we go. It's Dr. Fabi.
Thank you. The poll is still present on my screen. Are you able to remove it off of there?
Is it gone now?
Mm-mm. So let me just.
I think that might just because you're a panelist. Could you just move that to the side?
I'm going to try to escape out for everyone and do that. Okay. So a common concern that I get from many patients is jowling, or a perception that the lower face is getting bigger as a function of age. And so I'm going to be kind of educating everyone on why this happens. I know people have more time on their hands these days. And so this is just to kind of educate you on all of the various things that are happening as a function of age when it comes to our face, and the things that are out there and that are possible to be able to rectify those changes. When people come into the office, these are the multiple different things that are typically bothering them when it comes to their jawline, whether it's jowling, whether it's crepey skin along the neck, whether it's those bands or horizontal bands or lines along the neck, whether it's just no longer a sharp, well-defined jawline that they used to have. And so this video that I'm going to show you in a moment is going to kind of describe why that happens. But you can imagine that if there are all of these changes occurring as a function of age, that one modality is not appropriate to be able to address everything. And that's the reason why so many modalities exist. And I think that the biggest takeaway from today is that it's very who you see as your doctor, so that they know how to assess you in order to choose the right modality for you. And so this is a beautiful video that I love using to illustrate the point. When we start off as babies, we don't have the bone structure to support those fat, chubby cheeks and all of that skin. And our skeleton, our skull, continues to enlarge with age. And so you start to see in this person, when she goes into her teens, she has her face is filling out, and that's because that skull is growing. But as a function of age, that bone starts to break down at the age of 25. And that bone loss becomes significant by the age of 35. And so many of us have muscles that attach onto that jawline called the mandible. And so because you no longer have the bone to support that muscle, the muscles start to pull on the corners of the mouth, like you can start to see with her, casting a shadow, which we call the marionettes. And then you start, there's a blunting of the jawline. It's no longer sharp and well-defined like it used to be. And then the fat starts to reposition from the cheek into the jowls and even into this submental area, which we call a double chin. And to top it all off, you also have skin that's breaking down in collagen with 1% with each year of life. And so now you have thin skin sitting on top of this extra fat and this lack of bone and this extra muscle pull. And so there's many different facets to what contributes to that ill-defined jawline. And so when I approach my patients in a consultation, I typically like to reduce the fat first, because there's no need to add a bunch of filler along the jawline and make a woman look like a man, or make a man look heavier than he needs to be. If you have the bone there, it's just covered with fat. So it's a cost-effective way to use the bone you already have. And then once I've reduced that fat and I can appreciate the bone that you have, we can decide to add a little bit of filler. But many people on Instagram today see that filler can be done at the comfort of their doctor's office in 5 minutes. But just because it's easy to do doesn't mean it's the right thing to do. After I assess whether you need some filler, I also usually like to relax the muscles that are involved in making the jawline not look as defined as it used to be. Because there's a place for filler, but if you put too much filler, as again, you can make a woman look like a man, or you can make a man look heavier. And it's not just adding filler to the jawline. If you don't put it in the right place, it can make both a man and a woman look like the opposite sex. So how you place it makes a difference. And then I sometimes will go on to resurface the skin with a laser to thicken up that skin, because I told you collagen breaks down as a function of age, and then redrape it with something like Ultherapy to tighten things back up. So let's look at what we can do to reduce. So this is a great example of a gentleman. This is one of the most popular procedures in men in my office because the jawline is such an instrumental part to our perception of the masculinity of the man that we're looking at. And so if you have a stronger jawline, you look more masculine. There's actually a lot of studies, whether you look more commanding, whether you're taken more seriously. There's a lot of studies on this, psychosocial studies, but the jawline is probably the primary area that I address in a man first because it is so tied to masculinity. And so you can see in this man, after a single treatment that took about an hour, no more than an hour and a half, you can see that he looks better, about 10 years younger. And all that was done was a little bit of lipo combined with the laser to tighten up that skin. And so he didn't need any filler because he has the bone, it was just covered with a little bit of fat. And so now he looks like he's lost about 10 pounds and he looks about 10 years younger. So reducing the fat is a must first. And it's not just in men. This is one of my associates. You can see how much younger and thinner she looks just by reducing that fat. Now that man's result was just 6 weeks later. This doctor's result is 1 year later. So the results don't go away. In fact, they actually continue to improve. And in our office, we're lucky that we have lasers or radio frequency devices that we combine with the lipo on the same day. It adds another 30 minutes to the procedure, but it adds a world to the result. You can see with her how much tighter she looks. It almost looks like a surgical facelift result. And here she is a year later, because collagen doesn't just recreate overnight. It can take up to 6 months after the initial laser treatment to get the maximum result from that laser or radio frequency procedure. And so this is just an illustration of, after we do lipo, us just kind of going in, and at the very tip of that device, this is called Thermy RF, at the very tip of that probe, underneath the skin, we're able to dial the temperature and monitor the temperature so that we protect the top layer of the skin, but are able to heat the skin underneath at the right temperature to get the best results. So I recognize that not everybody is into these surgical procedures, and that non-surgical procedures are what some people are more open to. I say that lipo is the most definitive results, but if for whatever reason you are opposed to doing lipo, even though the downtime is typically about 5 days, in that we have to use a tape to tape you up afterward. If you're not open to that, then we do offer Coolsculpting at our practice. And again, this is a procedure that the doctors in our office, we apply it ourselves. Most of us apply it ourselves for our own patients. I apply it myself for my own patients. And I think it's important that whoever is applying it is extremely experienced, because it will reduce about 20 to 30% of the fat in that particular area. And we like to overlap in our office to get the best result. So you can see in this patient, a single treatment 3 months later, but I use 2 cups and I overlap them to give her the best result versus just using 1 cup. So the number of cups makes a difference because only the area that is in contact with the cup is going to reduce in fat. And then some people don't have the time to sit under the Coolsculpting device. With each cup, that takes about 45 minutes, so that's about an hour and a half. So just as long as lipo takes, but there's no 5-day downtime with a piece of tape. So that's the benefit of doing Coolsculpting. With both Coolsculpting, lipo, or Kybella, which is what you're seeing me mark for right here, you are going to have some level of numbness for about 6 to 8 weeks after the treatment. And you can get some level of bruising with all of them. So I think that's important to note. With Coolsculpting, I said you can get about a 20 to 30% reduction after a single treatment. With lipo, I usually say you can get about a 60 to 70% reduction after a single treatment. You don't want to reduce everything sometimes, or you may see a bit more excess skin. And with Kybella, the benefit here is that you can see me injecting here. The injections take no more than about 2 to 3 minutes. I was an investigator for this product and have been injecting it since 2012. The goal here is to inject it precisely and quickly so that when the burning sensation comes along after the treatment, within about 2 minutes, you are no longer having any injections. The only negative with Kybella is that you can get some swelling that can last about 7 days. And here I like to do at least 2 treatments spaced 3 months apart for about a 20 to 30% reduction. And so you can see in this gentleman, 3 months after 2 sessions, he has a fair amount of improvement, but he of course could probably benefit from more sessions if he wanted more of a result. So again, lipo is going to give you the best result, but I understand that not everybody has that 5 days of downtime for tape. Here you can get a good result. And if you're okay with this kind of result, Kybella is absolutely appropriate. It takes 5 minutes to do at the bedside, and the only downtime is really that bit of swelling and mild bruising if you get any. So with that, we have a poll question for you.
Hopefully this poll popped up for everyone and you guys could all answer. It's just one quick question to try and make this as interactive as possible. And thank you for those of you that are already submitting questions for Dr. Fabi. And, you know, welcome for, I know we have one dermatologist from Italy. Welcome. Okay, did everyone get their answers in? Only about half of you. Okay, I will end this. So let's see, here's where we have so far.
Interesting. So yeah, you know, even though lipo can give you the most, you know, defined jawline, just because you can get really underneath that bone to really chisel out the bone and give you that defined jawline that, you know, you may have had when you were in your 20s. The reality is that not everybody is okay with a probe or an instrument underneath the skin. And so Coolsculpting is absolutely appropriate. And as long as you have the realistic expectation that it may not give you the same result, you can combine that with something like Ultherapy to tighten up the skin and get a comprehensive result. Now, as I had mentioned, it's not just fat that contributes to an ill-defined jawline. It can also be a lack of bone. So you can see in this woman, she doesn't have the chin or a jawline to really support this fat underneath her chin. And so people come in like this and they want a skin tightening treatment. But I always explain to my patients that there's no way to tighten up the skin if you don't have the bone to support that soft tissue, that fat and that skin. And so with her, she was a model of mine in Israel. And so I injected her with 4 syringes of filler. And so here I did a syringe and a half into her chin. And you can see how her chin comes out a little bit more. And I used about a syringe and a half on the back of her jaw to build out that angle of her mandible. And you can see that just by building the bone back along her jawline, it has picked up a lot of that fat underneath her chin. So it just illustrates the importance of how much that bone plays with all of the jowling and the double chin that someone may see. And so these photos are immediately after injection. And so I'm gonna just quickly show her. This is a longer video. Let me see if I can lower the volume for you guys. And you can see with her, she's beautiful, 26-year-old, and she perceives that she has some jowling, but it's not that she has jowling, it's just that she doesn't have the bone to support the muscle that is pulling on the corners of her mouth and making her look maybe like she's a little sad or unhappy, because she's perfectly happy. And so using, in this case, Juvederm Voluma off-label, you can see that I'm building up her chin, and she's quite comfortable as I do it. And she's doing just fine. And so this in my office, in the office, takes about no more than 15 minutes to do. it's important that whoever's injecting you recognizes the proportions of a chin, because they're different between a man and a woman. And so if you make the chin too pointy in a man, he will look more feminized. And if you make it look too wide in a woman, she will look more masculine. This is a pet peeve of mine. So people will sometimes make a decision to go and get, you know, their jawline augmented and make it based on price, make their decision based on price. You only have one face. So just be mindful of that. It's important that whoever you see does a lot of this so that they can keep your masculine and feminine proportions in place. And so here I'm using a cannula, which is a soft tip tube. This helps minimize any bruising, and this keeps my insertion point at the very bottom along her jawline, so that you can see she has like no bruising and barely any bleeding. And that's a result of using a needle in some areas where it's appropriate and there's not a lot of blood vessels, and then a cannula in other areas. So you can see her just with the chin, 2 syringes later, immediately after. She looks better, but now I'm electing to inject the back of her jaw because again, the chin is just the front part of the bone. The back of the bone is this angle of the mandible, which is what we call it. And so again, using 1 syringe per side, we can get a pretty nice result. I'm gonna go ahead and escape out of here and just move on to her photos. You can see her 9 months after the treatment, and you can just see by injecting along her jawline, no other procedures were done, how more feminine proportions have been restored, how she looks like she has a more defined jawline, and how it looks like she doesn't have as much jowling, which is what she perceived to have. So she just looks, we've reestablished harmony in her face. This is one of my medical assistants. Many of you may know her. Again, beautiful. She wanted filler into her lips. A common mistake that I see is that if you put filler in a lip and that somebody doesn't have a chin, you end up making them look like Daffy Duck. And so the lip does not live in a vacuum. It lives in harmony with not just the chin, but the jaw. And so it's important that whoever's injecting you knows those particular proportions so that it can make someone look natural. And so here you would never know that she's had anything done as a result. Now, female proportions are different than male proportions. And this is a man, he's a male model. You would be like, where can you possibly inject in this person? But in a man, you actually want the width of the jaw to be about the width of the cheek. And so you can see after 3 syringes of Radiesse, he's had a little bit of neuromodulator to his upper face, but 3 years later, he looks even more masculine. He looks more manly, and that's because we've restored more masculine proportions. So whoever you're seeing has to have an artistic eye to be able to even appreciate these subtleties, because it's not just about injecting just for the sake of injecting. And so you can see here with him, now he has more shadow along the back of his jaw as well, as more dimension has been created with that Radiesse. So this is another one of my associates, and I'm basically just showing, you know, he's pretty comfortable. He was talking to me during the procedure, not now while I actually have a needle in his face, but this is to illustrate the importance and where I'm injecting this, when I'm injecting, to really square out that angle of the mandible or the back of that jawline in men. And then again, using that blunt tipped cannula that I was telling you about, which is something that I use so that I can hide my injection points and minimize bruising for my patients, and to make the procedure more comfortable for my patients. And so you can see him from below. If you look at the left side of your screen, you can see how much wider and more masculine his jaw looks than the other side, where it kind of tapers more like a V and looks more feminine. Here he is. I did a little bit of laser on him as well, but you can appreciate the jawline, and just kind of building that makes him look a little bit more attractive and more masculine. So with that, we have one more poll question.
All right, everyone. So there should be a
Have
second.
you ever had filler for your jawline? We're always kind of curious to know. Yes or no?
Thank you. All right, a few more seconds here. Please press submit. Okay. All right, ending this now. Can you see the results, Dr. Fabi?
Okay. Reset. I'm trying to.
So basically
can
the
hear you
results
guys.
showed that about 75% of the people have not ever had filler to their jawline.
Okay, good. And so now we're going to move on to relaxing. So there's definitely a place for relaxing the muscles of the lower face. We actually have there's one muscle that adds width to our face called the masseter muscle. And then we have about 3 different muscles that pull on the corners of our mouth down. One is called the platysma, and that interdigitates with the muscle right here that pulls the corners of our mouth down called the depressor anguli oris. And then the muscle that pulls our lip down called the depressor labii inferioris. So we have those 4 muscles at play with contouring the lower face. And then we have 2 additional muscles, the one that can cause a little bit of puckering, or we call it peau d'orange or orange peeled skin of the chin, and then the muscle around the lips. So those are the muscles that we're working with when we're dealing with lower facial muscles. And those muscles, at least 4 of them, participate in taking away from the ideal triangle of youth in a woman. And so once when we were younger, our face kind of went up, like an inverted triangle, and as a function of age, it can start to go down and pull, not just here creating jowls, but also the width of the masseter muscle. So this is an excellent example. This is a 31-year-old woman that came in wanting injections into her nasolabial fold. For the people that are on this call who are my patients, you know that I have no problem saying no to you, because my job and my ethical responsibility is to always make you look like the best version of yourself, not just to make you happy and do what you tell me to do. And so if I had injected her nasolabial folds, I would have made her face look more flat and more masculine. And so she trusted me. And so I was able to, by reducing the width of her face by injecting into the masseter muscle and then putting a little bit of filler into her cheeks, we restored more feminine proportions, and her nasolabial folds were the last thing that she was concerned about. So when I treat the masseters, it really is comprised of just 3 injections. So it's kind of quick. This is literally how long it takes. You can see that ball coming out back here, and that's the muscle that allows us to chew, but it doesn't need to be that big. In Western countries, about 67% of us clench or will clench at some point in our life. So you can see with her, 2 weeks after reducing her masseter muscle and putting a little bit of filler in her cheeks, she looks a little bit more feminine, looks a little prettier, and the nasolabial folds are the least of her concern. And so from an angle, again, it's just making the face kind of go up, drawing the eye up, versus here she has more masculine proportions in that the width of her cheeks are the width of her lower face. This is another beautiful example. This is a patient, and something that I've been seeing a lot again, mainly because of influences on Instagram and other social media platforms, people that want buccal fat pad removals. So not everybody is a candidate for that, and I would highly discourage anyone from considering that, because your 25-year-old self may want that so that your face doesn't look so round and young, but your 45-year-old self will be very upset with you because it's going to add to the wrinkles that you will eventually show here and the jowling that you may see, because you will no longer have the fat to support that skin. So I get assessed by someone who does a lot of lower face and neck contouring to see if there are other ways that you can kind of address this. And I just put a little bit of Botox into her masseters. It's off label. It's not used for that indication, but we use it off label there. And then I used a little bit of filler in her chin, and that slimmed her face without having to take away any of her fat. This is another beautiful patient of mine where she came in wanting Kybella. Her lower face is full, not because of fat, but because of her muscle activity. You can see how wide her lower face is because she clenches. And something in some of the projects that I've been working on, one particular project we actually published on, and we were the first to publish on it, is that people who clench or grind at night end up starting to recruit their neck muscle called the platysma that I was telling you guys about. And when you start recruiting that muscle, you can see the width of her neck. I did not do lipo on her. All I did on her, Botox to her masseters and her platysma. And in doing so, she looks slimmer, not just from her face, but also from her neck. And so here she is 1 month after 2 treatment cycles. And when I do treatments for this, I usually do it every 4 months, and then after about 2 or 3 injections, you can push it out to even every 6 months. But you can see how her face has been recontoured by just reducing the muscle. She did not need any Kybella to reduce any fat in her lower face. Does she still have a little bit of fat in a double chin? Yes, that hasn't gone away. So you can see that she did not lose any weight. It's just to show you and illustrate the power of the muscle in widening the lower face and neck. So again, it's important that you're open-minded to the recommendations of the person that you're seeing, because if it is a muscle issue and you're doing lipo or filler, you're never gonna get this kind of result, because here you need either Botox, Dysport, or Xeomin, or Jawline in order to relax those muscles. This is another beautiful patient. With her, I also helped reduce some of that muscle pull, but you can see how her eyes are contracted, right? So by relaxing the muscle that's pulling on her lower face and adding to a little bit of the jowling, and by putting a little bit of filler, she looks just a little prettier and more feminine. So it's not about being able to identify where the filler went in her face. It's the goal of the treatments that we do is to just make her look like the best version of herself. And so the muscle that I was telling you about, the platysma, is the muscle that makes some of these bands, which all of us at a subconscious level associates with age. And so you can see with her, when she no longer has those bands, how it stops pulling on the corners of the mouth and how it softens the entire contour of her lower face. So with that, we have an additional poll question.
Okay, thank you, Dr. Fabi. All right, a new poll should be up on everyone's screen asking, do you grind or clench your teeth? So either yes or no. For many of you, this may be at night while you're sleeping. It could also be during the day. So, you know, some people daily, some people just occasionally, but answer the best that you can. Okay, a couple more seconds to press submit. All right. We'll be closing this poll now. Thank you. All right. So there are the results for you, Dr. Fabi.
Which is interesting, right? Because what did I tell you guys? In a study, 67% of people were found to clench or grind at some point in their life in Western countries. And so it's about 60% in this poll. We don't have 100 people on the call. So I would probably propose that if we did, we'd probably hit that 67% number. So it's very much in alignment. And so the good news about it is that you should protect your teeth if you do happen to clench or grind at night, because losing a tooth adds significant exponential bone loss to your face, which is very hard to restore, and our fillers are not bone, so they're not going to restore the bone that you can lose. So it's important to really protect those teeth. And so mouth guards will help. There are two different kinds. You can always talk to your dentist more about them. There are some that have a bigger space in between them. They might be uncomfortable to get used to, but the nice thing about those is that for those that get migraines or headaches from grinding at night or clenching at night, the canine teeth don't touch. And it's when those canines touch that it propagates the grinding movement. And so it's thicker also, so it has a greater protection effect on your teeth, because I even have some grinders or clenchers that will say that they crack through their mouth guards. And once you crack a tooth, that's much more expensive than doing a little bit of neuromodulator every 6 months to relax that force on your teeth. So something to consider, mouth guard. It won't stop you necessarily from grinding or clenching when you're not using it. So you can still consider using Botox, Dysport, Xeomin, or Jeuveau off-label by consulting with one of us for that. And then I leave you with the last part, which is redraping. So we've covered reducing the fat. We've covered reestablishing the bone that we lose with age. And then we've covered relaxing the muscles that are pulling on the corners of the mouth and blunting the jawline because they no longer have bone to properly sit on. But there's also the element of skin. And we're losing collagen at 1% with each year of life the moment that we're born. And so what can we do to stimulate that new collagen production? And so I do a lot of CO2 laser resurfacing, and that will stimulate collagen production at the very top layer of the skin, but typically no deeper than about 600 to 700 microns on the neck, and no more than about 1 to 1.3 millimeters on the face. But we're losing collagen much deeper than that. We're losing collagen at the levels of the muscle or the fascia that enwraps that muscle. And so for that reason, we use Ultherapy a lot in our practice. It's the only device that has a non-surgical indication to lift the skin underneath the chin. None of the other devices have that indication. And the nice thing with Ultherapy, the reason why it makes a difference on who you see is because you need to be able to have them know what to look for under ultrasound. And so not everybody knows how to read ultrasound. And so if you fire this device and don't know what you're looking at, you may not get the result. I get that common complaint from people that have had this done elsewhere. But if you do have someone who is well-versed in what to look for on ultrasound, and they're specifically targeting the muscle and then the second layer of the skin, after a single treatment, you can get an excellent result that starts to show in as early as 3 months with full effects at 6 months that last a minimum of a year. And so in my office, I generally have my patients doing it once a year just to maintain, but you can even go as far as every 2 years. And what's great about this is that it not only keeps you taut, but it also improves the quality of the skin. And so this is a beautiful 44-year-old patient who was scared to do lipo. And you can see, you know, she has that little bit of fat, but she didn't want to do lipo. And she just wanted to tighten up the skin. She was very bothered by the bands along her neck. And so we opted to do Ultherapy. And you can see how she looks tauter when you tighten up that muscle and you tighten up that skin. She still has some fat there, but at least it's improved in its appearance because some of the fat is under the muscle. So if you tighten up the muscle, it's kind of like a sling. You pull everything that's underneath it with it. And so she just has a better defined jawline as a result. So this is another modality. The beautiful thing about Ultherapy is that there's no downtime. It's a single treatment. The negative thing about it is that it's not a warm massage, and it takes about an hour and a half to perform. And so the nice thing in our office is that we offer nitrous or laughing gas. And we specifically use Pronox, which is a blend of nitrous with oxygen so that you don't get as many of the side effects that you may have gotten with laughing gas at your dentist. and that allows you to basically feel completely normal, or back to normal at least, about an hour after the treatment. And so again, this is nice in that it doesn't have any downtime and you can resume your daily activity. This is a 55-year-old woman. This is to really illustrate what I've been talking about the entire time. On the left of your screen, she's there with having had no treatment ever. In the middle of the screen is 3 months after a single Ultherapy treatment, and you can see how it tightened up all of that skin along her neck. But she still has a little bit of jowling because, as I explained, there's a component of volume and bone loss. And so when I use just 2 syringes of filler, at the very end on the right-hand side of your screen, you can see how she not only has the laxity of her neck improved, her jowling improved, and the quality of her skin improved, all just by doing a little bit of Ultherapy and 2 syringes of filler. So the best results are results that are typically with a combination of different modalities. And so what I always tell my patients is that if you want to look good, you can just do 1 modality. If you want to look better, consider 2. If you want to look your best, sometimes you do need to consider up to even 3 modalities. And so with that, I thank you for your attention, and we're going to take some questions.
Yes. Okay. Thank you so much, Dr. Fabi. That was immensely informative. I'm sure everyone can agree, and I know they are because a lot of questions are coming in and positive feedback. So we already have a number of questions. I'm going to start giving them to Dr. Fabi. We have about 20 minutes left. If anyone else has more questions, please put them into the Q&A poll. If you can, try and put in your age and maybe a little bit of history so that Dr. Fabi can make the answer more specific for you. And just so we all know, just in case we can't get to all of them today, Dr. Fabi also has a webinar next Monday, which will just be open Q&A on any topic you would like. And she is, of course, also always available for virtual consultations at any time. Right now, we're offering those. So with that being said, let's go. So Candace says, hi, what is the best tightening for the neck and jowls? I can't take time off work. I'm 48 and would say I have light to moderate neck skin, but I do have jowling.
So again, kind of what we talked about first would be an assessment of your bone. You may need some filler along the bone since we have significant bone loss typically by the age of 35. So you need the structure to support any type of skin tightening treatment to support the skin. After I've made that assessment and we've relaxed any muscles that also may be pulling, creating some jowling, then my go-to treatment for no downtime would be Ultherapy. As with Thermy, there is downtime when we go underneath the skin. You have to be taped for a couple of days.
Okay, thank you. So this question piggybacks nicely with that. This is from Candace. She said, I've read in New Beauty that Ultherapy is good, but I have not read great reviews.
Yes, that's because in the United States, over 85% of the people performing the procedure are some, that are not physicians, some that do not have necessarily the anatomic training to recognize what they're visualizing in ultrasound. If you go to countries like Brazil, Turkey, Italy, where I've lectured, you'll see the most beautiful results. And that's because you have people, physicians that are dedicated to doing this, that have taken a lot of anatomy courses and radiology courses where they knew what specific tissue planes look like in ultrasound, and then would treat. And in our practice, we do the treatments. The people that are doing the treatments have been doing it for over 10 years. So there's an experience with what you're visualizing when you do the treatment. So just like with anything, it matters who's doing it. And so I've had excellent results. I personally have done it every single year. And I wouldn't keep doing it if I didn't also believe that it gives excellent results.
Okay, great. All right, so here's one. It says, is microneedling with radio frequency an effective treatment to tighten your facial skin, particularly your jaw area?
It depends on the microneedling device. And so there are multiple microneedling devices in the United States. Depending on how deep the microneedling device goes, and how much heat it delivers and how long it delivers it for will dictate the kind of result that you can get. Presently, microneedling devices are not FDA cleared for lifting the skin. None of them have that indication. And so in our practice, there is a benefit to using them in darker skin types, specifically for acne scarring and for superficial wrinkles. But I have not seen overwhelmingly impressive results when it comes to truly lifting that skin.
Okay, thank you. All right, here's a new one. This says, what treatment would you recommend for a face and neck lift that's not actual surgery if you're 50 and the problem is not too advanced?
So that's hard to make that comment, that generalization, if I haven't assessed you. I mean, it would first depend on if you have fat or you don't have fat. And then there I would probably do lipo combined with a little bit of laser. And then once you've recovered from that, with generally, you know, you get the skin tightening benefit for up to 6 months after, I generally will add filler to that area, typically about 6 weeks or even 3 months later, and even a little bit of Botox before the lipo procedure. And then from there, that's generally all I need if you have fat in the area and a little bit of jowling. But I can't make a general statement if I don't assess you.
Okay, great. So you might be a good candidate for a virtual consult where you can send photos ahead of time. And of course, Dr. Fabi can also see you while she assesses you. So the next question, Kybella versus Coolsculpt. What's the % in reduction between the two? On our poll, I chose Coolsculpt, but would be open to Kybella if you feel it's more effective.
I think with both treatments, people also complaining that they never saw a result. And I think what's important is that you get assessed by someone to make sure neither one of those modalities is going to work. If you're fat or the or double chin that you have is a function of big salivary glands, which make up 30% of the double chins that we see, or fat underneath the platysmal muscle makes up about 20% of the double chins that we see. And so if you have to first be assessed to make sure that it's fat that is on top of the muscle that's causing your double chin, because again, only 50% of people, based on a study that was done looking at the anatomy of double chins, found those patients to be appropriate candidates for either modality. Once we've established that it is, in fact, over the muscle, then I usually, it depends on how much of a distance you have between your chin and this hyoid bone. Because some people aren't candidates for Coolsculpting because there's not enough distance here, and so you won't be able to get suction. That fat can't get into the cup. You're limited by the cup. And so if you are a candidate and you actually have fat that fits into the cup, I typically would do Coolsculpting first to reduce that fat, debulk your fat, and then what's ever left, then I'll do Kybella. There's no trial comparing Coolsculpting versus Kybella.
Okay, thank you. So here's another one. Okay, a lot of questions are coming in, so we'll try and get to as many as we can. Let's see. How long do the fillers last in this jawline area?
It depends on the filler that's used, and it depends on how much is used. And hopefully in the near future, we're going to have a product called Volux coming out of Allergan that was approved in the EU last year, and clinical trials are presently undergoing here in the United States. And that's showing, at least in the European Union, to last about 2 years.
Okay, great. Here's an interesting one. Do you use silicone or any other permanent fillers instead of temporary fillers to eliminate the need for recurring treatments and expense?
Thank you for that question. I always tell my patients that you're not permanent, your face is not permanent, your skull is not permanent. And so I commonly see people that get injected at a younger age, believing that it's going to be more cost effective to use a permanent or longer lasting filler, 5 years or more. And 10 years later, that filler is still there, but they don't have the skull that they used to once have. And so you see free floating filler. And the only way to get rid of it at that point is to cut it out, as there's no antidote or agent to reverse that filler. So again, I wouldn't make decisions on your face from a cost savings perspective. You only have one face. And so I think it's more appropriate to use things that you can reverse if you don't like them, and you can reverse if for whatever reason it stays there longer than your skull is resorbing.
Okay, here's another one. Are there any procedures, do you do these procedures on older people older than 50 or just under 20-year-olds?
No, I treat my patient demographic is at least 40% of my patients are 50 years and older. And a lot of those patients have excellent results with treating any of these areas. The lipo patients that I showed you today were all 50 and over, and were some of the filler patients. So all people can benefit. Again, it's just that patients that may be a little bit older and have never had any treatment done before just may need more volume.
Okay, here's another good one. What about Thermy Tight versus Ultherapy?
There was one trial that we conducted in our practice where we didn't find there to be a significant difference in lifting of the skin underneath the jaw from it. So in my practice, as a result of that, then patients don't feel the need to Thermy, which is a more invasive procedure. You're going to get the same results with Ultherapy, which is a non-invasive, no downtime procedure that requires no tape. So for that reason, if it's just a skin issue, I just do Ultherapy. If there is some fat, then I'll do Thermy, and I combine it with a little bit of micro lipo so that I can get the fat out, as Ultherapy will not do anything to your fat.
Okay. Cynthia says, I have read about a newer procedure that involves a type of threading. Is that an option for lower face and neck lifting?
Yes, so there are threads. I like to use the Silhouette soft threads, which are a PLLA-based thread, very similar material to the material that is in Sculptra or makes up Sculptra, which is an injectable that I use quite a lot of, and I've been using for the last 10 years. And this stimulates collagen just like that material does. The nice thing about the Silhouette soft threads is that there are cones in those threads, so that when you insert them, you can fix the skin onto the underlying muscle and kind of tent it up. There are other threads like PDO threads that do stimulate collagen production. They're quite small though, and they don't have any cones. So there's really no tacking that is done. And so for that, I can't say that I could probably achieve the same type of lift result as I can with the threads. With the threads, you have to have thick enough skin in order to be able to mask the thread underneath the skin. So it's not for everybody. And generally, again, changes that you start to see along the jawline don't just live in a vacuum. You generally have some change in the lower face too. That's the reason why this talk is lower face and neck. And so you would require some threads in the face as well as in the neck to give you that result. And in my hands, results last about 1.5 years, 2 years, and patients are quite satisfied.
Fabulous. Okay. Let's see. Will lipo cause loose skin, or is this where you combine something like Thermy Tight?
That's why in our practice, we always combine it with Thermy or laser lipolysis. We have the Cool Lipo in our office. So we combine it with both. And in fact, you get tissue contraction from the procedure when you do it this way, at least under the neck.
Okay, thank you. Okay, here's one from a 35-year-old man. Is a double chin in men require any unique adjustments or treatments?
A double chin in a man, again, you have to be assessed to make sure that it's fat that's on top of the muscle. And if so, then you're a candidate for a fat reducing procedure, which I covered. And then I also typically see that men that have a double chin, depending on their weight and their bone status of their lower jaw, they may benefit from some filler to masculinize the lower face.
Okay. Let's see. Will RF tightening of loose neck skin work if I have very little fat but some laxity of neck skin? And what is the most effective RF treatment for neck tightening of loose skin with very minimal fat?
If there is no fat, then my procedure of choice is Ultherapy, as it's the only device that has a non-surgical indication for lifting of the skin underneath the chin.
Okay, great. How often do you recommend the filler in your jawline after your first procedure?
After your first procedure?
Mm-hmm.
I guess I don't understand that.
Okay, sorry, Janice, if
After
you could
what
please
procedure?
clarify a little bit. Okay, are there any possible side effects of getting lipo in your jawline?
Yes. You can develop a little pocket of fluid sometimes. That's the reason why we do tape for 5 days. You can develop firmness. Some people, because they're developing a lot of new collagen production, may experience that firmness more than others. It's something that is typically felt more than it is seen, and it feels kind of bumpy or hard underneath, and that can last anywhere between, typically lasts about 6 weeks, but I've seen it very mildly and up to 12 weeks in some. And then the last side effect that I usually warn my patients about, obviously bruising, right? Because we're underneath your skin, but the bruising is usually more on the chest than it is on the neck, because gravity will pull that blood down. And you can have, with any of the devices, so not just lipo, with Coolsculpting and with Kybella. In Kybella, the incidence of weakening the little nerve called the marginal mandibular nerve, which is a nerve that crosses over the jawline, you can weaken that nerve in up to 4% of people using Kybella, which is actually higher than in lipo. And in that case, I just usually relax the muscle on the other side to mask that. But those are pretty much the side effects.
Okay, and Janice explained her question again. She said, how long does the filler last in the jawline, and how often do you have to do and keep retouching it?
So we answered this a bit. It really comes down to which filler is used, how much of that filler was used. If you used less filler, any clinical trial will show you that it doesn't last as long as if you use more filler, because there's more to break down and therefore it lasts longer. In my experience, I'm generally if my patients allow me to treat them to full correction, because full correction means a different amount for everyone, I generally will be retouching them at a year, not because they've lost all their filler, but because they want to keep the same result that they left my office with. And that usually means that they don't need as much as they did initially.
Okay, all right. I think we have time for 2 more. So here's another one about duration. If you start getting neuromodulators in your jaw for grinding, do you have to keep getting treatment every 6 months forever, or how often would you get it for the long run?
Well, I can only comment on my experience in my office, and I've been injecting the masseters for the last 10 years. There's no drug that's presently FDA approved for this indication, so they have not looked at people in a controlled setting in a prospective trial yet. So in my experience in the practice, what I find is that patients do need to keep coming back, and it's generally 6 months. Some can push it out to 9 months. In the publications that are out there in the literature, the thought is that if you do inject it, some people will cease to grind or clench, and that will retrain them to bite or grind in a different way, so that it will retrain how you bite, and you may no longer do that. But we're not doing that trial right now, and we haven't done that in our patients. So I'd say that, yeah, if you want to keep the result, you would probably keep doing it every 6 months to even 9 months.
Very interesting. Okay. Is there a good preventative treatment for jowling? I can start to see a bit of drooping, but would love to do a treatment to help prevent. This is from Sandra.
Again, it depends why you have it. If it's muscle, then all you've got to do is relax the muscle. If it's from a little bit of a weak jaw, all you have to do is put a little bit of filler along the jawline. If it's because of a little bit of skin laxity, then it just comes down to tightening up the skin with Ultherapy. And if it's because of a little bit of fat, you could even do Kybella to the jowls. So it's not a one treatment fits all. But if you get properly assessed by someone, you can absolutely, there are ways to navigate around that so that you minimize the appearance of that. So I think that concludes.
So much. Yeah,
Thank you so much,
Dr.
everyone,
Fabi.
for being, so engaged and asking us so many questions. I'm going to be doing a question and answer session for all of you who I was not able to answer your questions next Monday at 12 p.m. Pacific Standard Time. And I'm actually, for those who follow me on my social, I'm doing this Friday at 11 in the morning, just some things that you can do at home to just holistically anti-age. I won't be talking about treatments, but I'll just be talking about things that you can do at home. Since we don't have as much control and can't do as many things for ourselves right now by going to our doctor's offices or hairstylists or estheticians, there are still things that you can do in the comfort of your own home.
Fabulous. And I will be on for a few more minutes. I am going to paste another link if anyone is interested in a virtual consultation. I will also post, if you've registered for this webinar, you are already registered for Dr. Fabi's Q&A. You will receive a reminder an hour before, and we are also sending out the recording from this webinar at the end of the week, as well as for the Q&As. So you guys will always be able to see those on YouTube and our website. And overall, I really hope you guys found this so informative. It's very, amazing to get so much of Dr. Fabi's undivided attention on this hot topic. So thank you for tuning in.
Thank you, everyone.
And we look forward to seeing you tomorrow. We also have another webinar coming up for the practice, which is tomorrow is an open Q&A with our physician assistant, Layzanne. So she's a great one to talk about, especially more about Coolsculpting and vaginal rejuvenation and any of the procedures that she focuses on. So thank you so much again, everyone. I will post these links one last time in the chat. All right, so that is, let's see. And all right, so I hope you guys can all see this. I just posted the link. I will post Dr. Fabi. Someone just asked for her social media links. Let me grab those for you. Instagram. So the practice is on Instagram and Facebook, and then each of our doctors are also on Instagram and Facebook. So here is Dr. Fabi Instagram. And here's the practice Instagram. Can you guys all see these links that I'm posting in? I hope so. Okay, someone is saying no. So let's see. All right, let's do this. So in case you don't see them, in her Instagram handle is at, well, her Facebook handle, that's what I have up now, is at Sabrina, Dr. Sabrina Fabi, at DRSABRINA Fabi. That's on Facebook. And on Instagram, I believe she is at Sabrina.Fabi. So SABRINA.FABI. The practice also, if you have trouble seeing any of this or writing it down as fast as I'm speaking, you're also always welcome to go to our website, clderm.com. On the contact page are two things. One, you can set up a virtual consultation yourself. Two, you could just email us a message if you want to discuss something or ask a question, or even to have us email you the Instagram handle or Facebook handle. You can use it all there. So clderm.com. Ultimately, we are trying to do this series to be as educational and informative as possible, but we understand we all want to look and feel our best. So Dr. Fabi is definitely available for any virtual consultations. The questions that I didn't get, oh, thank you, Maria. Tomorrow's webinar is at 12 p.m. It is with Layzanne, who is our physician assistant, and she is a Coolsculpting master. So she's phenomenal to answer more questions about Coolsculpting. She also does a lot of vaginal rejuvenation with Thermy Tight. And she does kind of IPL and some other Clear and Brilliant, other less downtime laser procedures. So please tune in at 12 to talk to Layzanne. And then on Wednesday, we have our body sculpting session with Dr. Kimberly Butterwick. She's going to be explaining our full array of body sculpting and tightening procedures such as lipo and Coolsculpting. So a little similar than we did today, but more focused on the body, the abdomen, the legs, inner and outer thighs, you know, the sagging skin over the knees, the arms, basically everywhere else in the body that we all have issues with. So otherwise, thank you so much again for tuning in. The questions that we didn't get answered, I will save next week for Dr. Fabi, so please tune in. And I hope you all have a great rest of your Monday. Thank you so much. Bye.